during treatment. And for today's evaluation, I'll just be asking you a few questions to get an idea of what could be contributing to your pain. And as we go with the session, we'll do some testing measures as well to assess further other contributions to what you're feeling right now. Does that sound good?
Yes.
Okay. So first, what brings you?
My back.
Your back. And what have you been feeling in your back?
Overall, I feel like a soreness, mainly in my lower back, and then occasionally I'll feel like sharp pains.
Is it more so all throughout the back, or is it more so on one side than the other?
The sharp pains are the overall soreness. The soreness, I think, is all throughout. The sharp pains is usually only in like one side, but I think I do get them on like both sides.
So it kind of just changes from one
Yeah.
side to the other.
Yeah.
Do you notice any specific movements or things that you do that you notice more on one side than the other?
I'm not sure. When I like bend down to like pick things up, I guess maybe like which way I'm bending or like which side.
Do you remember specifically anything happening when your pain first started?
Not like a specific event, but I did a lot of sports in middle and high school. I'm sure that contributed.
What sports did you do?
I did track and cross country.
Yeah, I also did CrossFit. Not like track. Let's see. Since how long would you say that your pain has been going?
I'd say overall since high school, so maybe like 3-4 years. Like it changes.
And since then, has it been kind of consistent or worsening, improving since today?
I think it's been like going like up and down.
Have you gone to PT before for your lower back?
No.
Do you have any previous injuries or medical conditions that could be contributing to what you're feeling?
I have flat feet, so I'm assuming that's something with like my like alignment is probably causing the issues maybe.
And then have you also gone to the doctor recently assessing all that? And then aggravating factors. Is there anything that makes your pain worse? Specific movements, positions, activities?
Bending down to pick things up. Or like reaching up high to get something.
When you reach, you feel it.
Like mid. Yes.
Is it reaching standing and sitting?
Yeah, I think more so it's standing.
And then is there anything that makes your symptoms better?
Laying on my back, I think.
Do you do any icing or heat?
No.
Do you take any pain medications or anything of that sort?
Not specifically for my back.
Do you take any medications?
No. I have some prescribed.
How is your pain when you first wake up in the morning? And how does it change throughout the day?
I'd say in the morning and the nights is when it's worse, I guess. Yeah. Because I think the way I'm sleeping isn't helping.
How do you sleep?
Kind of all of the ways. Like I'll start on one side and then it'll start to hurt, so then I'll go to the other side and then that'll hurt and then I'll be on my back for a little bit and then I'll hurt my stomach for a little bit. So every way.
Does it ever wake you up at night? Or is it,
I don't think so.
no? So does it interrupt your sleep? Let's see. When you have the pain in the morning, does it feel, how would you describe it? Is it
Like sore.
sore? And you said it goes down throughout the day?
Yeah, once I start like getting up and like moving around, it will like feel a little better.
Let's see. Are you experiencing any increased stress, anxiety, or depression related to your low back pain right now?
I guess stress. I don't know if that would be like, I don't know what would be like related to my back. But like in general.
In general?
Yeah.
Do you ever feel afraid or kind of hesitant to perform certain movements that afraid that it might make things worse?
If I like reach to like get that thing and like I feel like a sharp pain, I'll like move a little like slower, a little like stiffer for a bit.
Let's see. Have you had any unexplained weight loss lately?
No.
Do you get any fever, chills, or night sweats?
No.
Have you had any recent bladder or bowel dysfunction?
No.
And then, have you had any unexplained numbness or weakness through your legs?
No.
And what do you do for work?
I am a server.
Server? What are your hours?
They're sorry for that. Maybe like a little under, like around 35 hours a week. Sometimes a little more, sometimes a little less.
How's your pain while you're at work?
More than now.
More than now? And then, right now, if you had to rate your pain on a scale of 0 to 10, what would you rate it about?
Like
30? 40?
yeah.
And then when you're at work, what would you rate it there?
Like 6, 7.
What's the worst your pain has been, like, at any given time? The past few days or weeks?
Maybe like 8.
8. And then, what do your daily activities look like? What do you do when you're not at work?
I go to classes. Classes.
How's your low back when you're sitting in classes? Does it come on after being sat for a few minutes or more than a few minutes?
I think a little longer than a few minutes. Like I like maybe like half of the class.
But how long is your class?
They're usually like an hour 15. Some are like 55 minutes.
Do you live alone with friends or family?
Friends.
Do y'all live in an apartment or a house?
Apartment.
And how is it getting into the house or apartment? Is there stairs or elevator or anything?
No.
Do you have a support system?
Yes.
And overall, what are your goals to achieve with physical therapy?
To increase my range of movement.
And any other goals, anything you'd like to go back to or to be able to do without pain?
Can it be like not back related? Okay. I did like running, and I stopped running because like I didn't continue running after high school because of my feet and shins. So maybe that without the feet and the shin problems.
Right now, do y'all have any other questions?
At best.
What is your favorite best?
Like a 1.
One is
I'd say somewhere in like the middle of the day. Any previous surgeries?
have you had any previous surgeries?
Do they have to be back related? I got my wisdom teeth out.
Wisdom.
Can you show us where your pain is, like on your back?
Yeah. Also, I am now feeling it like up, like near my shoulders.
Near your shoulders.
So usually it's like
Yeah.
like here. Right now though, I think because I'm like slouching, I'm feeling it like here.
Have you had neck pain before?
Yes.
How long have you had neck pain before this?
Maybe a few months.
A few months. Is that new? From different people with that pain?
Yeah.
Do you remember anything specifically happening to your neck?
No, I don't think so. I tend to feel it more after I sleep, like my back.
Your upper pain, is it more so on one side or is it kind of all throughout?
I can feel it all throughout, but I feel it more on this side.
On the right side?
Yeah.
And does that pain, does it stay like central or does it go down your arms?
I would say it stays central.
Central.
Is your low back pain or lower back pain at all?
Maybe my hips. I don't think lower than that.
Shall I proceed? Okay. So, based on everything you've told me so far, it does seem that pain could be contributing to how you sleep, or again, from doing certain movements with your reaching, forward and bending down. So, but we'll do further tests and measures to assess exactly again where or what could be causing it. Does that sound good? Okay. So next I'm going to do a little order screening exam just to assess your spine so I can identify or rule out if there's anything contributing from there. Okay? So first I'm going to be doing axial compression, which means I'm going to come behind you. I'm going to apply some resistance at your shoulders, press it, push down, and I want you to let me know if there's a change in symptoms that you're experiencing, if it goes down, right, central. Okay. So at first I'm just going to lower you so your feet are touching the ground. And I'll come behind you. I'm going to put my hands on your shoulders and sit relax. Push down. Feel it. Okay.
Could you do it one more time? They kind of, I think, alleviated a little bit. The
On this side,
up here.
the right shoulder, there's something alleviation. Okay. And then next, I'm going to do a decompression. So I'm going to ask you to hug this pillow. I'll stand in front of you. Okay. Hug this pillow like this, and then I'm going to come around, hug your shoulders, and I'm going to bring you up. And again, let me know if there's a change in symptoms with that being moved. Okay. Back.
I think I felt the same.
Felt the same? Kind of moved right there. Or
Oh no, like the same. Like I didn't feel much change.
not much change. Sounds good. So now we're gonna continue progressing with the session, and we're gonna switch student physical therapist. Do you have any questions for me so far as well?
No, I don't think so.
No? Good. So first I'm gonna set you sitting. Sitting in front of you. Alright, Kevin, go ahead and touch your toe. Are you ticklish?
Yes.
Okay. Those are normal. ASIS is normal. Alright, that's good. I'm actually going to kind of lift your ear just a little bit. So that's good. Alright, so next thing I'm gonna have you do, I'm gonna have you walk. Yeah, we're gonna, yeah. So come this way. Okay. Alright, I want you to go ahead and walk towards that door, okay? Okay. Okay, good. Go ahead and come back. Do you have any pain while you're doing that?
Oh, I don't think so.
Come this way. Can you do it one more time for me?
Oh, like from back here.
Yeah. Okay. Okay, back. Alright. That's good there. Okay. Oh, there's actually one more thing I want to check. You go ahead and act like you're squashing kind of over me.
This way?
Yeah. Okay, good. And then same thing again. Right, good. Okay. So, next thing I want you to do is we're gonna go ahead and do like some motions and see if you can breathe with me, okay? So first thing I want you to do is we're gonna have you come forward just a little bit so you're at the table. Alright, I'm gonna have you bend forward, lift at your toes. Good. Okay. And then go ahead and do that one more time. Good. Any pain with that?
Does it have to be to my back?
No.
Or just any?
Any pain.
Well, I should stretch more.
Okay, I got you. Got you, got you. Alright, I'm gonna apply a little flight circle down one more time. Just a little pressure, okay? Okay, did that cause any,
Yeah,
is
this.
that okay? Just your hamstrings and your calves?
Yeah.
Okay, right side up. Alright, next I'm gonna do, let's go ahead and go back, so I should go this way. Okay. Just put your hands in your ears like that.
Okay.
Now just go, just a little further. Good? Anything there?
Like right in.
Okay. We're just gonna go. Wait, okay, so I'm not gonna apply any more pressure. Exacerbate your symptoms. Alright, that's good. Alright, can you put your hands to your side? Can you go ahead and bend down for me? Good. Come up. And let's come back. Do that one more time. Good. Hold it right there. Anything there?
Like here.
Right, feeling it? Okay, I have to do it.
Yeah.
Alright, go ahead. Do the other side. Good. And then do it.
Oops.
Do it one more time. Good. Anything there?
Yeah, I think this side though it's going up more.
It's going up more.
Like it's traveling.
Okay. Alright. That's good. And then let's see. I'm gonna have you sit down. You can sit back on. Alright, so I want you to cross your arms. Alright, and I'm gonna have you run to the side. Okay, deep in there.
Yeah. Here.
Okay, can you do it one more time?
Bit that.
Good. Okay, so you start, so you have so can you go to the right? Deep in there.
The same but less than the other
The
side.
same but less.
Yeah.
Alright, so next thing we're gonna do is gonna be over here. So I'm gonna have you, I want you to extend. So you're gonna bring your weight.
Oh.
Alright, so you're gonna bring backwards. I want you to side bend to one side, and I want you to rotate towards that side, okay? So that'll help you with yours. Alright, so go ahead, come backwards. Good. And I want you to side bend, and I want you to rotate down. Good. Are you being there?
I just popped my back.
Okay.
Um,
Anything?
Yeah, like the same area, like the mid.
Here, right there?
Yeah.
Okay, can you go ahead and do that one more time for me? Good. So can you go ahead and bring your right foot up? Good.
No.
Okay, left foot. Good. Okay. Let's see. Actually. Yeah, can you bring your, take your heel? Just bring your chin.
Up my shin. Wait, this was like I'm doing like a workout.
Okay. Alright. Can you do the other side for me?
Nothing like specific.
Okay. Good, in there.
Wait, actually. Oh, wait. Yes, sir. Yes, actually.
Yes, what are you feeling in there?
I feel like it feels weird actually. I feel like I can't I don't have as much like I can't rotate this.
Okay, we're gonna try it again in different positions. Okay. So can you go ahead and lie on that? No, I'm doing afterwards. Alright, go ahead and lie your back. Yeah. It's getting really slow. Huh?
How high do you need to go?
High enough for me to not hurt my own back while I'm evaluating you. I think this should be good. Alright, can I actually take your shoes off?
Please. I think I did this off normal.
The first thing I'm gonna have you do is I want you to lie on your side and face me.
This.
Okay. Yes. Yeah. And then can you come closer? Good. And I want you to go ahead and bend your knees. Good. Alright, so what I'm gonna do is I'm gonna take you, so you know how we did like the lifting your legs and everything. I'm gonna do everything past you, so I want you to go ahead and relax. Okay? I'm gonna come over here to just restriction while I'm doing this. Can you actually, yeah, can you slide down? Sorry.
Oh, down this way.
A little more. Sorry. Alright, that's good. Okay, yeah. Alright. And then still, so I want your body like to be like, well, yes, but I want you to come, bring your trunk closer. Yep. That's it. Alright, so I want you to go ahead and relax for me. Sorry, actually scoot, bring your bottom towards me. Yeah, like, yeah, there you go, that's much better. Okay. Any pain there? I'm gonna bring you all the way up. Anything there? Okay. So nothing, just okay? Okay. I'm gonna bring you the other way. Scoot down a little bit more. Thank you. So sorry. It's okay. Alright. Yes. That's good. Alright. So anything when I bring you this way? Okay. Anything there?
Wait, do that again.
Okay, you're having some guarding while I'm doing this. So just relax for me. Yeah, so basically, because I'm moving your joints the way they're supposed to be doing, so if you're having some, like, if they're not moving as much as they should be normally, and I'm starting to put them in that position, your muscles might tense up and guard.
Oh, like not supposed to do that?
Yeah. It's like your muscles saying danger, danger.
Oh wait, actually, go a little more that way.
Is that painful?
Yeah, I feel it.
Okay.
Can you guys line up for me? Alright, so next we're going to do yeah. Alright. So let me know if this is your lesson. Anything there? Still okay? Alright. Good. So now I'm gonna have you since your approximation is good for all of them. Alright, so I'm gonna put my hand under here. So I'm just gonna rotate you just a little bit, okay? So I'm gonna have my hand over here. I'm gonna bring it this way. Ready? Yeah, that's this way. Okay, sorry.
Yeah.
Okay, ready?
Oh.
No, you're not supposed to fly out too. Alright, ready? Anything there? Anything there? Okay. Anything there? Anything there? Okay. Flip to the other side. Alright, check your right side. Okay. Let's go ahead and do. Alright. Ready? Yes. Anything? Okay. So, listen here.
Right hand on the spine. Left hand.
How I had it last time. Oh, okay. I was like,
I think the right arm is supposed. Your
Yeah.
left arm is the one that's feeling the spine.
yeah.
Yeah.
So I had like this.
Yeah.
Yeah. Okay. So like this. Okay. You can relax your
Oh,
arm.
I don't know where to put
No,
it.
you can just put it up my arm. That's fine.
Okay.
You ready? Anything there?
No.
I'm gonna do this one.
It feels different than when you're on the other side.
It's okay.
Alright. Does it feel like worse?
No, it just feels like
It just feels the movement's different?
Yeah. Maybe I'm sitting.
No, you're not. Does it feel like I'm getting more of a rotation this time?
No, I think I felt more last time. Maybe this. No, I think I felt more last time. I think I was sitting more like that. My hips were like under. Just now.
Oh, yeah.
There we go.
Okay. got it.
That feels fine.
Okay. Over here. Is it good?
Yeah.
Okay, cool. Alright, stand like that now.
Okay, it's good.
Alright, I'm just gonna check your hips really fast, okay?
Like, on my side.
No, you can do it. Alright, go ahead and bring your right knee up to your chest. What, not right knee.
Oh.
Alright, go ahead and bring it up. That's right, you can bring it. Okay.
Stretching related, but not.
Okay, but not. Okay,
No.
okay. Good. Go to the other side. Actually, I'm just gonna really fast. And that's just stretching related.
Yeah.
To the other side. I think. Starting to go?
Yes.
Okay. Anything there? You didn't feel any pain when I was doing that, right?
I think I did actually.
Oh.
That wasn't like stretching related. I was
Okay,
still
what
trying
was
to
that?
figure out if I.
Yeah, so you
that
were a
was-
little limited when you were moving it yourself, and I was able to push you into more range there. But did you feel back pain when you were doing that?
Oh, back pain?
Or any pain?
Yeah.
What did you feel?
It didn't feel like, because if it was stretching related, I would have felt it what, like here?
Yeah.
We felt it like here.
Okay. All right, noted. Oh, can you like this way? Can you bring? I want you to bring your ankle towards the white. The white curve.
Oh, I see. Like turn it like,
Yes,
like
yes.
a Hollywood stretch.
Yes. Oh, they're called Hollywood.
Mm-hmm.
Oh, I see. All right.
But also IT now.
All right, that's good. Now, can you have the other way?
Oh,
There you go.
that's
Okay.
it.
That's it.
I mean, is it supposed to go farther than that?
Ready? Yeah, that's good. Okay then.
No.
Alright, same thing. Where's the thing? Good? Same thing. Alright, you okay then?
Wait. No.
Okay.
I think towards the curve. There
This
was.
way?
Yeah, similar to when it was bending, like when you were
In the same spot?
Pinned up, yeah.
Okay. Is there anything else you guys want me to do?
Did you do the quadrant testing?
Yes.
Okay.
Yeah, that was when she was sitting down.
Okay.
And it was,
How was that?
she was feeling it in like the same spot.
For both the left
You
and
would have had to do this.
Yeah.
Yeah.
It felt, it was going up higher
Mhm.
when I did it this way, to my right.
To your right.
Yeah. But overall, it's
Anything else?
did you do hip? And her hip flexion on the left, about 127, and then the right.
Where was normal? Yeah, that was the only one she was limited and active.
Okay.
When she could go further when I came back.
And no pain with extra rotations, right?
No. I think actually on the left leg.
Left leg.
Was that
Okay.
one of
I thought that was
Yes.
internal.
Oh, that's
Yeah.
sorry, the other way. No, the other way. This way. No pain here?
no, but that way.
But the other way.
Internal.
Wait, which one?
For internal, not external.
Was she okay with this?
No, she didn't. Oh. Oh, when she was sitting.
When I was doing the shin thing,
Yeah.
a little bit, yeah. I feel like I couldn't move my legs.
And then when you're doing lumbar extension, and she noted pain when you were doing the pivot, do you
Yes.
remember what level you were at?
It was L2, L3.
Level 2, 3. Okay. Gotcha.
And then also, so honestly, all the way down to L2 to L5.
Oh,
Yeah. So I did it.
Slide it.
Yes. Okay. Well, so that was the first part of your physical examination. So I'm gonna have Brian do the second part. Okay.
Hi there, Cameron. I'm Brian. I'm also going to be your student for today.
Okay.
So I'm going to be tuning your physical examination and training started. The first thing we're doing is we're going to do a couple functional things, look at how you move when you're doing different tasks you might do throughout a day.
Okay.
So to start with, could you actually just sit up for me here?
Yes.
We'll lower the stage down a little bit. You can swing your legs off the side here.
Okay.
Any pain with that when you sat up there?
No, I don't think so.
And I'd like you to actually just reach down and put these shoes back on.
Okay.
Any pain or difficulty with that?
No difficulty, but a little bit I feel it.
A little pain? Okay. Well, then you can stand up. And I'd like you to just do a couple squats here, just 5 squats.
Okay. It's my forehouse.
However you would normally squat down, like as if you were going to go pick something up off the ground.
Oh, okay. Like this?
Yeah, sure. And just do a couple more there. Any pain with these?
In my knees.
My Nothing in the back?
No.
Okay. And the last one, we're going to take a walk over here to these stairs.
Okay.
Probably guess what we're doing. I want you to just go up, take a second at the top, and then come back down. Come back down. Any pain in either of those directions? Yeah. Head on back. And just standing for a second. Do you have any issues with like your balance, like trying to start falling, catching yourself, anything like that?
Yeah, I like tip over sometimes.
Sometimes. You notice anything that happens that you normally precedes it? If I do this, then I'm gonna lose my balance.
If I stand up quickly.
Okay. Get a little busy headed.
Yeah.
We're gonna take a quick look at that balance real quick. So you can turn around so you're facing the table there. The table's gonna be in front of you, so you're gonna have your hands over just so you can kind of capture motion. Quick check. So feet together there. Feeling pretty good here. Okay, you can go ahead and raise your arms out in front of you there. Just sit on the table. And then just close your eyes for me. I'm here behind you to guard you and catch you easy.
Okay.
Any issues here? That looks pretty good. Now you can open your eyes back up. And I want you to stand now just on your right leg. So lift your left foot up. Thing. A little unsteady here. Try closing your eyes a little bit. And I'm here to guard you. Good. You can open them back up. Left foot down. Now eyes open still with the right foot up. To the side is easier, worse, or same than the other.
I think this is easier.
Okay. Try closing your eyes here. Easier with the eyes closed as well.
No, harder with the eyes closed.
Harder with the eyes closed.
Yes.
Okay, open them back up. Now we're gonna try one foot in front of the other. You can pick which one you want to start with. So right in, like heel to toe.
Okay.
Same thing, eyes open here.
We're just gonna start with some questions so you can sit down.
Which one feeling? Try closing the eyes.
Whoa.
I got you.
When I close my eyes, it's harder for all of
A little tough, yeah.
Yeah.
Okay, open them back up.
Okay.
And then switch your feet around. Start the eyes open again. Same thing as with eyes open. Same thing, easier, worse, or same this way compared to the other foot in front.
I think the other foot in front is a little easier.
Try closing the eyes. We got up here. Open it back up. A little trouble with the eyes closed, but nothing major there. What I would like to do next is you can turn and face me. So right now standing, do you feel that like back pain?
A little bit.
Okay, I'd like you to try doing, take a step forward here.
Okay.
I want you to just reach forward down towards your toes as far as you can, and then come back up. And we're gonna do that about 10 times. So just
Okay.
up and down. And what I want you to do, keep an eye on your pain. I want you to tell me if it feels like it's spreading, maybe going down towards your hip, or if it feels like it's getting smaller, kind of localizing in one area.
Okay.
So try just 10 up and downs here. Back up. Again. Actually, just go for 5. So does it feel like your pain spread a little bit, localized, or about the same?
I think localized.
So it feels like it's maybe a smaller area.
Yeah. Like here-ish.
How about that lower?
The lower pin I think like spreads.
Okay. We're gonna try the other way now. So
Okay.
you can put your arms behind you, and we're just gonna lean back as far as you can. Same thing for 5 times.
And then if you get too
Should be the last one. Same thing. Feel like it's spread, localized, or about the same?
I think spreads.
Spread for both the
For-
upper and lower?
I don't feel anything in the upper right. It's
Okay.
just the
Like,
lower.
okay, it feels like it's spread a little bit too.
Mhm.
Did it go into the hip at all? Or just kind of
Just my back.
you can go ahead and take a seat. Just take a seat here facing me. Just get it there. I want to do a quick sensor screen in your back. So I'm just going to come behind you. I'll lift your shirt up a little bit. And I'm going to run my hands along the sides of your back. I'm going to have you close your eyes. I want you to tell me if it feels the same, left to right. And then I'll tap one side. And I want you to tell me which side I'm touching, okay?
Okay.
So I'm just going to come behind you here. And lift your shirt up. Is that all right?
Yeah.
I'm going to start off just running my hands across. Close your eyes. Does it feel the same left and right?
Yes.
Same thing? Still feeling the same? Alright, last one. Alright. I'm just gonna have a light touch on one side. I want you to tell me if I'm touching your left side or your right side. Okay, ready?
Was there any
Which side am I touching here?
Left.
Here?
Right.
Nothing related to that. And then
Right.
your
Everything looks
exercise
normal there.
asthma, is that controlled by medication?
Down for you. The next part of this is we're going to do a couple strength testing. I'll start with some of your hips, then we'll move on to some of your back and abs. So for the hips to start with, what I'd like you to do, and you can sort of grab onto the side of the table to help support yourself.
Okay.
I want you, we'll start with your right side. Just raise your right leg up as high as you can. Great, and then go back down, and we'll go about halfway. And then same, don't let me push your leg down here. You ready? So
Yeah.
hold it here. Hold. 2, 3, 4, 5. That's good. That's good.
Okay.
3 plus. Send me to the left, up as high as you can. Back down. Bring it up about halfway. Slowly push it down here. Hold. 2, 3, 4,
And then
5. Yeah. Same thing about 3 plus. Next one. So if you remember before, we're gonna try to kick this knee or this ankle up towards your other leg. So twist your hip in. Oh, sorry. So keep your leg down. Just rotate it.
Okay.
Try it that way. Just as far as you can. Bring it back. I'll go about halfway. Same thing. Don't let me push you in here. So you ready? Hold it here. Hold. 2, 3, 4. Keep going. 5. There we go. Give me a 4 there. Same thing. Turn that again. Good. Down. About halfway. Let me push it in here. Hold it here. Hold. 2, 3, 4, 5. A little weaker, maybe 3 plus. Now I'm gonna go the opposite way, so kick this heel out.
Okay.
Back down. Any pain with any of these we've done so far?
With this one a little bit, I think.
A little bit. Where do you feel?
Here. Just a little bit.
The hip.
Yeah.
Come up about halfway. Same thing. Go ahead and push it in here. Hold it here. Hold. 2, 3, 4, 5. Good. 4 plus. Yeah, with pain. And same thing. Kick this one out. Good. And then down about halfway. Hold it here.
So we're gonna start off on this
2, 3, 4, 5. Good. Yeah, about 4 plus.
No.
Just the right side?
Mhm.
Go ahead and move it down. We're going to start with you. We're going to flip you around here.
Okay.
I have you go. You can take your shoes off as well. Have you go down to this side. So the first one here is I'm going to look at your abs.
Okay.
So I want you. So you're going to bend your knees up about a 90-degree angle. So you can come out a little more, a little more, a little more. Right there. And I want you to put your hands right by the side of your hips. I want you to keep your head neutral. Slide your hands up, do a little crunch. So slide your arms up until they're touching your heels.
Oh, wait, keep my head.
Keep your like neck neutral. So don't like flex it all the way, bend it back.
But you
Just
can like lift off the.
yeah.
Oh,
You're gonna
okay.
lift your head and back up.
Okay.
We're just doing a crunch here.
Okay.
So all the way until your fingers touch your heels and hold it there. Feel pretty good here. Any pain?
I think so.
And then you can go back down. And now, a little different here. I want you to try arms up by your ears. And keep your head neutral, so don't like pull your neck forward.
Okay.
And just lift up your upper back until like your shoulder blades come off the table.
Okay.
I'll be here to help give you a little guide. It's right there. That's it.
Wait.
A little tougher.
Have to hold it.
Yeah, so hold it there as long as
Okay.
you can.
Like here.
Yep. And then can you get a little higher? Not quite.
Okay, one more time.
Okay, try it again. And hold it, hold it, hold it. Ugh. Try with the arms crossed.
Okay.
And then just lift up here so your shoulder blade comes off. And then hold it there. 2, 3. It's tough. It's a tough one.
Yeah.
Yeah, you should got like 4 seconds with that one, maybe 2 with the arms. We're gonna flip over now.
Okay.
Yeah, you're gonna flip over on your stomach. But I want to explain what we're gonna do first.
Okay.
So for this one, it's the same thing. So we're gonna have on your back. You're gonna have your arms by your side, and you're just gonna lift your back up, sort of arch your back until your breastbone and your sternum comes off the table.
Okay.
So I'm gonna slide this under your abdomen, so hips up here. Great. So then we start with arms to your side, and then here, I can take the glasses for you.
Thank you.
And you're gonna tuck your chin into your neck,
Okay.
and then we'll lift up if you can. Lift up here, a little further if you can. Further. There we go. Hold it there.
Okay.
Keep that chin tucked.
Oh.
Hold it. Can you get a little higher? Hold it there. Okay, relax.
Okay.
Yeah. Maybe 5-6 seconds.
How many are we supposed to be able to do?
For that one, honestly, that's really good.
Oh, not bad. A lot of people lose that pretty early.
Okay.
You can switch positions here. We're gonna go into sort of a kneeling on your hands and knees.
Okay.
This one. Leg.
My skin.
So for this one, we're gonna do. Have you ever heard of like a bird dog? We're gonna have. Okay, this is gonna be basically you're gonna be kneeling and you're gonna lift off one arm.
Oh,
and
and
the,
one- and the
opposite
opposite
leg.
leg. Oh, okay,
And I'm gonna be feeling for some of the small stabilizer muscles in your back.
Like yoga.
Yeah, it's like a yoga pose.
Okay.
So I'm gonna roll your shirt. Is that okay?
Yeah.
All right.
Yeah.
Now I'm just gonna feel for your hips so I can know what level I'm at here. Alright. Okay, so what I'd like you to do here is first lift up your right arm,
Okay.
and then now your left leg,
Does it have to be straight?
just as far as you can. And then back down. Try that again, same one, same time this time.
Is there different times going up those stairs?
Okay, and then back. A little tough.
Yeah, a little bit.
Okay, now lift just the left arm. Okay, and down. And now left arm and right leg at the same time. And back down. And then one more time.
So what I'm gonna have you do first,
Okay, and back.
so you're good for squats. You can stand
Try
up.
this right arm and left leg.
And what I want you to do is just have your hands like across your chest.
This side is harder.
Squat down, do it like a comfortable depth.
Which is a
and
little
then just
delayed
come up.
with that
Yeah.
one.
Do that
On
5
which
times.
side?
So with right arm and
So
left leg.
left,
Yeah.
yes.
A little delayed in that. So it'll work on. And then the last strength test I've got for you is you're gonna lay back down, and I want you to just kick your thigh up from the table.
Okay.
Take your glasses again, right?
Oh, thank you.
And then next, we're just gonna see
So
your
we'll start with the right side.
So what I want you
So,
to do.
Do I need to be like flat?
yeah, flat.
Okay.
And
So
try
just
not to
lift, kick this left leg up to the sky if you can.
The leg you're balancing on, just like keep it straight.
Back down.
And don't try to hold that.
So
for
try to
about
keep
2
your
seconds.
hips down. I'll help find a little stabilization. So just the
Okay.
leg.
Oh wait.
There you go. And then come back up. Don't let me push you down here. Just bring it
Okay.
back up. Don't let me push you down. Hold it here. 1, 2, 3, 4, 5. Yeah, just like that. Same thing with this side.
Okay.
Just the leg
Go
up.
and stable it all on the other side. Or
Good. Back down. Same thing. Bring it up halfway.
any pain.
Don't let me push you down. Hold it here. Hold. 2, 3, 4. Yeah, 5.
Alright.
Normal
So
reach.
then I'll have you sit down next.
Any pain with those?
And then
No.
Any pain with any of those other ones we did? Like the sort of the kneeling one, the abs, the back. And then the last thing I'm going to do here is we're going to look at how your vertebrae are moving. So I'm going to go along each level of your lower back, just push a little bit of pressure on it and see if it reduces any of
back area.
Okay.
and just see how they're moving. See if they're moving a little too much, not enough. So you can just lay down and relax.
Okay.
Alright, so I'll have you stand back up. So for the next test,
I'm going to roll your shirt up. Is that all right?
so what I want you to do is put your hands across your chest.
Roll your shorts down a little.
Bend to the side. You gotta rotate to the same side.
Same thing.
And have it stare at
3, 2,
Bend to the right. This.
1.
And then rotate to the right. And also.
Alright, so I'm going to start just a little gentle pressure here. Just tell me if at any point this reproduces your lower back pain, okay?
Okay.
Doesn't make it even worse.
How's that?
That's fine.
And then same thing on the other side. Bend to the left. Rotate to the left.
Still good there?
Is that okay?
That one.
A little painful there. So L3 UPA, or sorry, L3 CPA painful. Next one, 4. How's that one?
Oh, a little bit. Better than the other one.
Okay. CPA L4 is painful, but less than L3. And then last one, 5. How's that one?
The same as the last one.
Same thing. So a little painful, but not as bad as the 1, 2 before.
Is it hypo?
It's a little stiff. Now we're gonna come. Can I take a look at your thumb size real quick? A little smaller than mine. Okay. So we're gonna do some of the ones off to the sides here.
Okay.
4. 1. So we'll go a little less than my thumb. Right here. Start with the left. How's this?
That's fine.
Okay.
So now I'll have you when you're swimming.
Same thing on that side.
Say you had some like.
That one I think I feel a little bit, but none in my like lower back, like in like the middle.
Feel it sort of like up here.
A little lower.
A little lower, more like here.
Yeah.
Okay. So L1, if it's that UPA, it's a little mid back pain. Right. No, sorry.
Or is the pressure?
I don't think. Could you do it again?
Yep.
Do you have any nails?
No?
Oh, okay. I don't think it's the pressure. I think it's.
Okay. No, they're freshly trimmed. Next one down. Start with this side.
That one's okay.
Good there. About this side.
That one
A little painful.
Yeah.
Okay. That's L2, right? How's this one?
That one's okay.
Alright.
That one. I feel it.
Gotcha. How is this one compared to the first two?
I think that one's a little more.
A little more painful?
Mm-hmm.
The L3, right? These are all the right side. They're all painful. No, all right.
All left.
Yeah, 1, 2, 3. L1, 2, 3 on the right have all been painful. 3 is the worst so far.
Oh.
Down to L4. Okay,
That
on this
one I
side.
feel a little bit.
A little bit on that side too.
Mhm.
Okay. On this side. How about over here?
That one's the worst one so
Worst one yet? Okay, so L4, both sides. The right is the worst one yet. Then last one here.
I'm gonna assist you with your leg straight and raise it up.
How's this one?
That one's most okay.
What's that?
That one's okay. I feel like a tiny bit. But
Tiny bit? Okay. And then last one here. How's that?
I think it's worse than, not worse than the one you just did on the right side.
The second worst?
Yeah.
Okay. So L1 through 5, all the rights are painful. 4 was the worst, 5 was the second worst. And then L4 left was also a bit painful, not too bad. And then last one here, I'm gonna do one more a little further off to the side. They shouldn't be. Start with over here, a little further away. How's this?
That one's good.
Okay. Here.
No.
Oh, I forgot to mention, the sets are all pretty hypo. What's that?
That one is a little bit.
Little uncomfortable on L2? Okay.
That one feels the same as the other side.
Okay.
That one.
Same thing, a little painful?
Yeah.
How's this side?
That one's okay.
Okay. L2 and 3 TPs on the right. Painful.
That one's okay. That one's okay. That one's okay.
Okay.
That one's okay.
Last one. Okay. So just L2 and 3 for the TPs.
On the left.
On the right.
Right.
Okay. And then I'm going to do a couple quick tests. I want to make sure that this pain isn't coming from this joint down at the base of your spine that links your spine with your hip bones.
Okay.
So just apply a little bit of pressure to that. I want to show if that reproduces any pain for you, okay?
Okay.
So we'll start here. Same thing, just a quick little pressure. Any pain with this?
No.
No? No pain? Okay. Sacral thrust negative. And I'm actually going to have you flip over here.
Okay.
Just one last quick thing. Get your glasses back.
Thank you.
So I think I want to take one quick more look at that joint. This time I'm going to
Okay.
apply a little bit of pressure, sort of squeezing your hip bones together, then pushing them apart.
Okay.
So I'm just going to feel for your hip bones. So a little pressure here. Are you producing your pain?
Not the same pain.
Okay, what do you feel? Is it just, besides just pressure on your hip bones from my hand?
Can you
What do you
time?
think? Yeah.
Actually, a teeny bit, I think, in my lower back. Just
Team in the lower back? And I'm going to try the opposite way here.
Mhm.
So how's this one? This one might not be super comfortable in the front. How's that?
I think more so. In the
More
back.
so?
Yeah.
Okay. And then the last test I want to do, just look at your hamstrings. I want you to tell me, I'm going to raise your leg up.
Okay.
Tell me if that reproduces your low back pain. And if it goes anything down the leg too, especially.
Yes, and
Is it just hamstring stretch or is it pain?
I feel it in my back. I don't think I feel it going down my leg.
Okay, that's good. Did you feel it on one side more than the other?
I don't think so.
Same thing on this side. On your back here.
Yeah.
Okay, I want you to try something. I'm gonna lower you down a little bit. Can you pull your feet towards your head? Does that change it? Better, worse, or same?
It's the same for my back.
Okay. A little more stretch maybe. Try that this side too. So a little back pain there. So pull the foot towards. Better, worse, or same?
Same.
Okay. I think that's everything. I think you guys missed it. The SI joint compression distraction with distractions of course. I think that's everything. Anything else? Okay.
Hey Cameron. Hey, so I'm Carrie. I'm another physical therapist here at Michigan State. And so you were talking about your lower back pain, and Brian just he identified several spots on your lower back that are particularly sore, painful. So what we're going to do next is I'm going to perform some manual therapy on those areas. One in particular, the one that was like the most irritating for you. And so what we're going to do is I'm just going to stay in that area and apply some light pressure, some oscillations, and this will hopefully help manage some of your pain. So I want to ask right now, how bad is your back pain on a scale of 0 being no pain, 10 being really bad pain? You need to go to the emergency room.
Well, right now I don't feel anything like sitting, like where we were like using pressure.
Yeah.
But I do like higher.
Okay.
Maybe like a 3.
Okay, gotcha. So what I'm gonna do is I'm gonna have you lay face down on the table. I'm going to be in that area for around a minute applying some pressure, okay? And then at the end, I'm just gonna reevaluate your pain.
Okay. Should I not put this back?
Oh yes, yeah. If you could take your shirt off. Do you want to use your shirt to like put around the bowl of the people? Yeah, gotcha. Okay. So I'm just going to roll up your shirt. Is that okay? Okay, perfect. I'm gonna warn you, my hands are a little bit
Oh, yeah, I feel
cold. I'm so sorry. It's okay. Okay. So I'm just gonna feel around for some structures. Okay. It's okay. Okay. Is this like where that pain is localized? Okay, perfect. So we're just gonna go nice and easy. You let me know if this is like, if it becomes painful at any point, okay?
Okay.
All right, ready? So we'll go for 1 minute.
Which grade are you doing?
I'm doing grade 2.
A little bit.
It's a little bit painful. All right, I'll ease up on it.
I gotcha.
Okay.
A little longer.
Okay. Good? Okay. Alright, so we're gonna take a little rest. And under normal circumstances, we do this like 3 more times. But yes, how are you feeling right now?
Now it feels okay.
Now it feels okay? Okay. Do we want to do a EPA really quick? Or no? I think this is good. Okay. All right. Sorry, we're running a bit low on time. Here, you can sit up, Cameron. Okay. So now how's your pain feeling? Let's go. Still at 0.
I think I can feel it a little more now.
You can feel a little bit more now. Okay. Maybe like a. Okay. I'm sorry about that. Okay. Yeah. So I guess it's all for manual treatment. Okay. Yes. That's what it is. Me? All right. We're almost there. Yeah. Almost there. Okay. All right. I am your last of your millions of PTs that you have today. My name is Emmy. Okay. So based off of everything that we saw today, I'm gonna give you 2 exercises. One is to help you kind of stretch, right? Because you're standing all day working, so it's a lot of continuous pressure, right? So I'm gonna teach you a little bit of a stretch and something to strengthen your core. That's gonna really help stabilize and help alleviate some of that pressure. Okay. So the first thing. Okay.
My shoes.
You can do whatever. That's fine. Okay. This is really tall for me. That's fine. Okay.
Other side, on your left.
Where? Oh. Alright. So. Okay, so what you're gonna do is from that seated position, you're gonna have your hands on the wall. Okay. This might be too short, too low, too high. You're gonna walk it forward. Just a nice stretch. You can hold it for like 2 to 3 seconds or so, and then walk it back. And you're gonna go middle, side, side. You can go side, middle, side. I don't care. Okay. But you're gonna walk it to the side, same thing, nice and slow. It should feel nice. If it doesn't, then maybe don't go as far. Okay. Another 2 or 3 seconds here. Walk it up. So the side, middle, side. We'll do that about 10 times around. But we'll just do a few. So maybe start on your right. And scoot a little bit to your space. So maybe go to the right first. And then walk it slowly out. Feel a nice little stretch. Relax your head. And then slowly walk it up. Does that feel different? More pain? Less pain? Less? Okay, great. Keep on going.
Okay. And then can you sit down on the table again?
Perfect. Come on up. So, so at the end, we'll wrap with giving you some exercises to do at home. So if you do one of your exercises, I'll give you like the dosage. Okay. Okay. Just for the sake of time, we'll pretend like we did 10 of them. Okay. And then our next one is for our disability part. Okay. So our abs a little bit weaker. So I want us to be able to kind of increase our muscle strength, so we can kind of help our back not hold all of our weight. Okay. So what we're gonna do is in a second, you're gonna lie on your back there on the table. Okay. Actually, go ahead and do that. Perfect. Okay. So you're going to bend your knees up for me. Okay. So the first thing I want you to do is something called a posterior column. So when I say pubic bone, you know where that is. Okay. So you're gonna feel like you're gonna bring your pubic bone to your rib. Yeah. So keep your hips down. Yeah. So we're engaging our back. So we're gonna let the lower back push up to the table by bringing your pubic bone to your.
Oh, this?
Yeah.
Okay.
Yeah. Where do you feel it?
Yeah, I can feel it.
Here? Okay, good. So what you're gonna do is you're gonna relax. You're gonna do that, so you're gonna bring that pubic bone to your rib to engage your stomach, right? And you're gonna lift up your right knee. And slow, good. While keeping that back, right? Press onto the table and slowly lower. Yep. Exactly.
Okay.
Yep. Do you feel that?
Yeah.
Yeah. Okay. And if you need to in between legs, you can relax and take a breath. But before you pick up your leg, I want you to think about that again.
Okay.
Yeah. So then, yep, exactly. And then do your other leg. Yep. And nice and slow lower. Yeah, good, good. I see it working.
Okay.
Do 2 more.
Okay.
So that gives us some
Okay.
good.
1 more on that side, the left
I'm
side.
going to test the ability of your joints.
Good. Okay. You can relax.
Okay.
You can sit up. So, was that easy, hard, or medium?
Medium.
Perfect. Okay. So I'll switch to the patient education portion. We're good? Yep. Okay. Cool. Okay. So
Thank you for working with all of us today. Okay, so from everything that we saw today, so we're thinking that it's a little bit more of an instability, muscular weakness that's causing more symptoms.
Okay.
And so if you find anything that helps to do pain, like for instance, if you're stretching, if this makes you feel better, definitely incorporate that into your day, right? So if you're standing at work, you're like, oh man, my back is hurting, that's great to do that. If you don't have a ball, if you have like a rolly chair, or like something you can sit on the table and do that with chair,
Okay.
as well. And then working on strengthening your core. Okay. I'm gonna give you a couple exercises to do as well. So for this one, we'll probably do this, like I said, rolling out 2 to 3 second holds 10 times. I'll give you, I'll send you something later with all of it. Same thing with this little portion of that guy. And I'll give you 2 more. While you're at work or anything like that, maybe, I know you also have some pain in your upper back as well, right? So if you tend to hold like a lot, this is the one side of the other. Yes, maybe try to alternate the hands. If you can bring it down to like 2 hands. Okay. Finding ways to make it a little bit lighter might help with the pain. It's probably compounding into your back.
Okay.
Yeah. And then, can you repeat back to me the 2 exercises we do today?
Yes. Okay. So something that you like roll or like move.
Yeah.
Walk it out and then you hold it for 3 seconds and then just walk back in. And then you go, if you do one middle to just side on the side, and do that 10 times and then like 3 reps of that. Sure. Yeah. And then the other one, you, I don't know what the one is, trapped.
Yeah.
Your pelvis and then raise one leg and then slowly lower that leg while still like holding. And then you do the other leg. I don't know how many moves.
I'll send it to you. Okay. In the email. Awesome. You want me to go through the other 2 exercises? Or anything else? Good? Okay. Cool. Do you have any questions?
I don't think so.
Okay. We will, again, send you an email of the list of exercises I want you to do this for. I'll write down how many times I'd like for you to do it per week, but if you only have time to do it once or twice, that's better than doing it at all. So, work with what you've got going on that week. We'll reach back out to you like every week. Yeah, to kind of see how you're doing. So, okay. Do you have any questions?
I don't think so.
Thank you so much.
Thank you.